All right, Speaker of the House Paul Ryan, of course, blasting Obamacare, saying it's a total disaster. Listen to this.
Obamacare is a story of broken promise after broken promise after broken promise, followed by failing program, higher premiums, higher deductibles. So we want to make sure that as we give relief to people through Obamacare, we do it in a transition that doesn't pull the rug out from anybody during that transition period. That's the point that we're all trying to make. This law has failed. It's getting worse. Families are hurting. No one has choices. We've got to fix this by replacing it with something better.
Well, Ryan does indeed vow that his party will replace the broken system, as he calls it, with something that works. So what exactly will this new healthcare system look like? Joining me now, Grace Marie Turner, president of the Galen Institute, and thank you so much for joining us. Okay, so we know there's going to be a transition phase. A lot has been made of, okay, great, throw it out, but what the heck are you going to put in there? And what happens in between that so-called transition period? What are the key elements here, do you believe, as we essentially dismantle Obamacare and go with something else?
Well, I think the first thing is to make sure people do understand nobody is going to lose the current coverage. Republicans get it that people are mad when they lost their coverage because of Obamacare. They don't want to do that again. That's why they are going to have a transition, a lifeboat, as you will say, to make sure people are protected while this debate continues. But the Republicans also have to build a bridge to better coverage. And to say that Republicans have no ideas, Neil, was just crazy. Dr. Tom Price, who's the nominee for HHS Secretary, has been introducing a comprehensive reform plan in every Congress since Obamacare was first debated. Many other members have legislation as well. Speaker Ryan led an effort with all of the key committee chairs and many staffers and most members of the House, the Republican caucus in the House last year, developing a plan that Paul Ryan released last June. So they do have ideas. They're 90% agreement on what needs to be done. Of course they're going to argue over some of the last 10%, as they should, to make sure they get it right. But they all agree that we need to help people at the lower end of the income scale in getting insurance so they can afford coverage. We need to protect people who have pre-existing conditions, but there are different ways to do it than with mandates that didn't work, by the way, and with all of the taxes and with all of the restrictions that Obamacare put in place. Give people more choice, allow the market to work, and most importantly, let the states be engaged. Washington has shown it cannot regulate health insurance. It does not know how to do this. But giving states more power to oversee their health insurance markets can make sure more policies are available that meet the needs of their citizens.
Grace Marie, let me get this in. One other thing that Neil brought up, of course he brought up many things actually, but one of those was on Medicaid and rolling back essentially the expansion of Medicaid. Is that a possibility?
The people who are on Medicaid now will continue to get coverage through Medicaid. There are many states that decided to not expand. They need to figure out how to create a level playing field. But siloing everybody into these different programs, Medicaid, the state children's health insurance program, exchange, employer coverage, giving people transitions so they don't lose coverage if they fall out of those programs and they become cliffs. You need to give people a transition so that if you are on Medicaid now and new subsidies are available, you can use that subsidy to buy a private plan among, by the way, a lot more plans that would be more attractive and more affordable because states are negotiating with health insurance companies to give those plans, make them suitable for the kind of policies their citizens want rather than the ones that the government told them they had to buy.
It all makes perfect sense, and let's hope it all comes about in a good and timely fashion. Grace Marie, thank you so much. We're out of time. Appreciate your comments today.